Hypothyroidism, an underactive thyroid, affects immense numbers of people in the USA and around the world. A slowdown in this gland of metabolism may impact many of your physiological procedures and cause many symptoms. What is a hypothyroidism disorder? Hypothyroidism happens with an underactive thyroid when it stops producing most of the hormones the body needs. The shortage of hormones causes chemical disruptions to the whole body, including the autoimmune system and metabolism. Luckily, treatment of hypothyroidism is quite simple if caught early. Patients with the condition frequently take hormonal supplements to maintain their bodies balanced. Thyroid disease may refer to some dysfunction of the thyroid gland, a sizable butterfly-shaped gland in the neck's front part. Men and women with thyroid disease, especially hypothyroidism, often experience foot pain, especially in the morning. The disturbance of chemicals and hormones in your body may lead to inflammation and swelling in the feet, ankles, and heels. It can also lead to tarsal tunnel syndrome, even where the tibial foot nerve is pinched or damaged. If you've got unexplained heel pain when you start your day and symptoms of hypothyroidism, your physician can recommend a blood test to test your thyroid. Home cures and non-prescription painkillers could work for mild to moderate heel pain. If you've got a sharp or sudden problem, visit your doctor. Your pain may be the result of an even more severe accident. Who is most likely to grow hypothyroidism? Postmenopausal females develop hypothyroidism a lot more than any other type since the body no longer produces enough hormones after menopause is complete. However, men and women of all ages could develop hypothyroidism. Hypothyroidism usually occurs in those with autoimmune ailments such as type 1 diabetes. Rheumatoid arthritis is another condition that can increase your chances of thyroid illness. For those who have an autoimmune disorder, you ought to be watching out for indications of either an overactive or underactive thyroid gland. Finally, if anybody in your family has hypothyroidism, your chances of having it are more significant. Check with your physician when you've got a family history of thyroid disorders. How hypothyroidism causes foot pain. The disruption of chemical and hormone production of the body can lead to autoimmune problems. The body begins to attack healthy regions of the body, such as joints and muscles. The affected areas could detract from inflammation and become stiff. In hypothyroid patients, this often happens in the ankles and feet. Still, another foot illness brought on by hypothyroidism is tarsal tunnel syndrome, posterior tibial neuralgia. Compared to carpal tunnel syndrome in wrists, this condition occurs after the foot nerve is pinched or damaged through pressure. The result is painful burning, numbness, or tingling throughout the entire body. Hypothyroidism inflammation is enough to compress the thoracic nerve and induce tarsal tunnel syndrome. How to deal with heel pain. Ice. Keep a small bottle filled with water in the freezer. Wrap it in a towel and place it lightly to your heels and foot in the afternoon. Massage. Roll a tennis or lacrosse ball along the base of the foot from the toes to heels. This may help release tension. You could also roll your foot on a foam roller. Or you could do a far more traditional massage by merely holding your foot into your hand and applying gentle pressure along the heels area with your hands. Stretching. Try the next stretches for heel pain. Heel cord and foot arch stretch towards a wall, step back with one foot and then bend your front knee, keeping both heels and feet to the ground. Lean forward slightly as you stretch. Hold 10 seconds, then relax. Repeat using the other side. Plantar fascia tension stretch sitting on both sides of your bed or a seat, cross the influenced foot across the knee, creating a 4 position using the hand on the side, lightly pull your feet back toward your shin. Wait for 10 seconds and relax. Repeat if desired, or switch sides. The best way to reduce heel soreness. The following steps will help stop morning pain. Keep a healthy weight and a healthy way of life. Being overweight or obese may put extra stress on the foot and heel area. Wear sturdy, supportive apparel, and avoid wearing high-heeled shoes. Replace running or athletic shoes every 400 kilometers or 500 miles. Try alternative pursuits, like cycling and swimming. Do stretches at home, particularly after your exercise. When to seek help. Make an appointment with a doctor. You've got of the following symptoms: morning heel pain that does not go away after a few weeks, even after trying home remedies, for example, ice heel pain, which lasts throughout the daytime and can be interfering with your everyday routine. Seek emergency medical advice if you notice any of the following: intense pain and swelling near your heel, intense heel pain that begins after an injury, heel pain accompanied by a fever, swelling, tingling or numbness, inability to walk normally. The bottom line. Heel pain during the daytime is a common sign of plantar fasciitis, however, other disorders may cause such a thyroid condition. Home remedies, for example, stretching and ice, may help with morning pain. If you have hypothyroidism, there are a few things that you can perform to look after the feet and minimize foot strain. To begin with, be sure to use shoes that are supportive and comfortable. Wearing shoes with high heels, are somewhat narrow in the toe box or do not offer enough support is hard on the joints and ligaments. Hypothyroidism can also aggravate the joints and muscles in your toes and feet. Whenever you combine those factors, wearing unsupportive shoes when you have hypothyroidism can lead to a lot of pain on your toes. Alternatively, choose shoes with low heels, open toe box, and plenty of support. Orthotics may also help relieve foot pain. Orthotics or custom arch supports are devices people place in the shoes. They manufacture them from a mold of one's foot to fit the feet perfectly and provide you with extra support where you need it. You can slip these devices into the shoes you wear daily to give you a perfect, supportive fit. Receiving a diagnosis of hypothyroidism isn't precisely excellent news, but it's an ordinary procedure. Visit your physician, and make sure you follow through on your plan of treatment. Ask your doctor about orthotics or habit arch supports. He may recommend that you stop by a shoe store to have these apparatus made. See your health care provider if you think you have an even far more severe accident or if your pain will not subside after a few weeks with natural home remedies.